and the men and women who serve, and we must always take best care of our veterans and our military people and their families. We need to rebuild the VA health system. It's in trouble, and it's not holding up well under the burden of our injured people coming back from Afghanistan and Iraq. We need to do better, in my opinion. And that's not an entitlement, folks. Our men and women who serve in the military, did so with the understanding that we promised we would provide for their health care. And I think we need to live up to that promise. That is not an entitlement. Medicare and Medicaid, speaking of health care, boy, problems there. We need to rebuild Medicare and rebuild Medicaid. Medicare for our seniors and the permanently disabled, Medicaid for the very poor. And as one of the few private doctors in the whole Puget Sound area who sees mainly Medicare and Medicaid patients, I know firsthand the problems that are confronting our people on those programs. Problems finding a doctor, problems getting things covered, problems navigating the system. In the Medicaid program for the poor, we have so few doctors in Puget Sound that see our patients that when I refer patients for specialty care, like say to have a hip joint replacement, I have a hard time finding a surgeon anywhere in the area that will take one of my Medicaid patients. In fact, even the University of Washington has turned some of them away. That's how bad it's gotten. Yeah, and so Marie Cantwell can talk the talk and say, oh, I'm a care for you kind of a Democrat. I care for people. But all I can say is the Patient Protection and Affordable Health Care Act, known as Obamacare, has hurt Medicare and Medicaid by cutting almost $500 billion out of those programs and not doing the hard work of rebuilding them so that they'll work. Now, I'd like to do that work. I'd like to provide that leadership in the Senate. There are only 3 doctors in the Senate. I'm told that one of them is not going to run for re-election, which would bring us to only 2. Yet, the federal budget is spending 25% of its money, if you believe it, a quarter of federal spending is to Centers for Medicare and Medicaid Services. That's staggering. Well, we need significant positive leadership on that issue. Too many people depend on it. 45 million people on Medicare and roughly the same on Medicaid. It's about 90 million people, folks, out of the 303 or so million people in America that depend on one of those 2 programs. So we need good, positive leadership. I'd like to help provide that.